Hello, Kevin Riddleberger. We are LK19 Consulting, and we are so excited to share our recommendations with you today on what healthcare providers you should partner with to help benefit your company, Dispatch Health. Imagine that you or a loved one is in need of healthcare and are unable to easily make it to your nearest hospital or healthcare provider for medical attention. This is the unfortunate reality for many people, especially for older populations with ongoing health problems. This is why there is a need and market for at-home healthcare. Thanks to you, Dispatch Health has and will help many people in need of such services. In order to help launch your startup company to a larger consumer base in America, we have recommendations to partner with two amazing healthcare providers that would work great with your current brand. But first, let's meet the LK19 consulting team.
Hi, I'm Henry Manning.
Hi, I'm John Bamke.
Hi, I'm Maren Clay.
Hi, I'm Michaela Strecker.
Hi, I'm Caitlin McMurphy, and after our team's analysis of Dispatch Health and the six potential healthcare providers available to partner with you, we have come to a conclusion that the best recommendation for you to pair with is Humana and Blue Shield California. We came to this conclusion after heavily evaluating which providers' target market alignment, long-term growth potential, financial attractiveness, and aligned interests would work best with Dispatch Health. We will go through each of these categories more in depth, starting off with Marin explaining how the target market of Humana and Blue Shield best aligns with Dispatch.
Thank you. By aligning with Humana and Blue Shield California, Dispatch can tap into a large and diverse patient population across Medicare, Medicaid, and private healthcare. Humana presents a strong opportunity in the Medicare sector, with 15.5 million patients in all 50 states, surpassing Optum's 13.7 million and far outpacing smaller players like WellMed and Intermountain Health. While Humana's Medicaid presence is smaller at 1.5 million patients in 9 states, its strong brand and broad geographic reach make it an ideal partner for expanding Dispatch Health's footprint and government-backed healthcare programs. Humana's typical patient is around 60 years old, takes 3 medications, and manages fewer than 2 serious illnesses, the precursor age group to Dispatch Health's existing customer demographics. This aligns perfectly as these patients are on the cusp of needing more intense and involved healthcare services as they age up. Meanwhile, Blue Shield California offers an entry point into private healthcare, where Dispatch Health can reach yet another patient base. Blue Shield serves 4.8 million private healthcare patients, more than Intermountain Health's 1.5 million, but significantly fewer than Kaiser's 12.6 million or Optum's 27.2 million. However, what makes Blue Shield a compelling partner is its alignment with Dispatch Health's care model. The average Blue Shield patient is 70 years old on 10 medications and managing 6 to 8 serious illnesses, which aligns perfectly with Dispatch Health's current target patient market. This means that these patients can greatly benefit from Dispatch Health's care solutions. By strategically partnering with Humana and Blue Shield, Dispatch Health can balance its reach across Medicare, Medicaid, and private healthcare. Next, I'm going to hand it over to John to talk about long-term growth potential.
As Dispatch Health expands, choosing partners with long-term stability and growth potential is essential. This is why Humana and Blue Shield California are the best options because they offer the best opportunities for expansion. Humana serves over 17 million people in Medicare and Medicaid, positioning itself as a leader in government-funded healthcare. Medicare membership has grown by 840K just by this year, reaching about 15.5 million members. Now, for the next slide, we have a graph created for you. With Humana having about 15.5 million Medicare members compared to United Care's 13.7 and WellMed's only 1 million Medicare members, it shows Humana's dominance in government-funded healthcare, and this ensures a large and growing patient base for Dispatch Health and for in-home services. However, there is a 20% administration fees on Medicare and Medicaid services, which will reduce profit margins. Despite this, Humana's Medicare growth and home wealth expansion makes it an ideal long-term partner. Now, for the next slide, we have Blue Shield California. It is a strong private insurance market that has about 4.8 million private insurance members ensuring stable revenue, as well as having 3 million members enrolled in their employers sponsored plans. Now, for the next slide, we have a graph presented for you guys. Blue Shield California has about 4.8 million total members, with as well for their private insurance members, as well as 3 million members enrolled in their employee sponsored plans. Kaiser Permanente has about 12.6 million private members, while Intermountain Health has 1.5. While Kaiser leads the private insurance market, Blue Shield's strong presence in employer sponsored plans provides a stable and high revenue partnership. With Blue Shield California, they only target the private insurance market and not Medicare and Medicaid coverage, which limits government funded patient accessibility. Private insurance focus does reduce expansion to low income and high need populations. However, Blue Shield's higher reimbursement rates and strong digital health investments ensure financial stability and tech driven growth. Now, handing it over to Henry to explain financial attractiveness.
First, when examining Medicaid financials, Humana has the second highest contribution percentage in total enrollment, making it the most well-rounded option. Optum United Healthcare has excellent enrollment numbers, but struggles with a mere 5.88% contribution margin, limiting profitability for DispatchHealth. WellMed offers impressive margins in Florida and Texas, but has low enrollment, making it a niche rather than a scalable option. Intermountain Health is the worst in both metrics, and is actually a liability, as its negative contribution margin would be a waste of time, money, and resources for DispatchHealth. Next, let's look at Medicare insurance statistics, where Humana again emerges as our strongest choice. Humana has lower contribution margins, but it shines with the highest total enrollment, making it a key volume driver for DispatchHealth. The only insurance partner even close to the enrollment of Humana is Optum United Healthcare, but their negative 6.66% contribution margin makes it financially unviable. WellMed offers the highest contribution margin, but lacks the enrollment numbers needed for large-scale profitability. Intermountain Health has healthy contribution margins, but is tied for the lowest enrollment numbers, limiting its financial upside. While WellMed and Intermountain Health boast more generous contribution margins, their Medicare patient enrollment is dwarfed by Humana's. Humana's combination of high enrollment and solid contribution margin makes it the best Medicare partner. The dynamic addition of Blue Shield of California completes our recommendation. Partnering with Blue Shield allows DispatchHealth to provide care for patients with any of the 3 types of insurance plans. Blue Shield stands out as the second highest contribution margin percentage among all options. Unfortunately, the total enrollment is the second lowest. By contrast, Optum United Healthcare, despite having the highest enrollment, has contribution margins more than twice as low as Blue Shield, making each visit much less lucrative. Intermountain Health offers the highest contribution margin, albeit only beating out Blue Shield by about 2.2%. The minor advantage is not especially attractive, though, once you realize Intermountain's enrollment is less than 1/3 of Blue Shield's. Kaiser Permanente, while offering a larger patient network, suffers from the second lowest contribution margin, reducing its overall financial benefit. Ultimately, Blue Shield of California provides the best combination of enrollment and margin. Now I'm going to pass it off to Michaela.
Thank you, Henry. As we know, Dispatch Health has ambitious goals of growing their company, and these partnerships could help in many ways. Humana is a newer company who is excelling in Medicare and expanding their Medicaid very quickly. Blue Shield California is a more existing company established over 80 years ago who also dominates in their sector of private insurance. By dominating all 3 sectors, Dispatch Health can expand their care into new levels. Humana's financial contribution margins of 16.67% for Medicare and 20% for Medicaid could provide insurance for many patients, while Blue Shield of California is an established company with $25 billion in profit and another $77 million invested in their local communities. Both these insurance partners could help financially support Dispatch Health in all 3 possible insurance programs, while also opening doors to many new opportunities. Humana and Blue Shield of California both serve target markets that closely align with Dispatch Health's demographic and healthcare needs. Humana's members generally skew younger than the industry average, but Blue Shield of California serves an older demographic. Despite these differences, both Humana and Blue Shield California share target markets and objectives that resonate with Dispatch Health's commitment to providing comprehensive healthcare access. This makes them exceptional channel partners in order to reach a broader audience. We believe Humana and Blue Shield California's mission statements encapsulate the mission Dispatch Health has for their own company, and these partnerships would allow Dispatch Health to work closer to their goals of healthcare for all. Humana has transitioned from a health insurance company to a healthcare service organization, showcasing a strong commitment to caring for patient needs. Meanwhile, Blue Shield California demonstrates their commitment by capping their net income at 2% and reinvesting the remainder into customer and community initiatives. The shared goals and values of these organizations make them ideal collaborators in the pursuit of comprehensive and accessible healthcare services. We understand a couple trade-offs that Dispatch Health will have to face by partnering with these two companies, opposed to others. But Humane and Blue Shield California are great fits in every category, making them the two perfect partnerships with several aligned interests. Caitlin is now going to summarize our recommendations.
Thank you, Michaela. Going off the points made regarding the target market, long-term growth potential, financial attractiveness, and aligned interests, we firmly believe that Dispatch Health would benefit from pairing with Humana and Blue Shield California. Now, Mr. Riddleberger, we strongly recommend that you follow our recommendations and pair with Humana and Blue Cross to get the most optimal results for your business, Dispatch Health. Thank you so much for listening.